Good day, it's Dr. McLean with Vital Energy Chiropractic. Today I want to talk to you about balance. And over the years here at Vital Energy Chiropractic, we've helped countless people with vertigo issues and balance issues. And there's a lot of things involved. What we typically find is issues in the neck. So you have something in our ear called our semicircular canals. And they are three canals that are positioned in different directions. So for example, you have one that's vertical, if you will. So if you tip your head to the side, there's liquid inside these tubes, and it puts more pressure on different hairs that are inside this tube, and it sends a signal to your brain to say, hey, the head's tipping this way. But think about how intricate this is. So if I tip my head to the side, it's not just my head that's tipping, of course, my whole body's got to adjust to that. So your brain's got to communicate to the rest of your muscles on a second-to-second basis very quickly to cause certain muscles to be tighter, certain muscles to be looser. So think about just the miracle of walking. Just the fact that we can walk upright, how much brain power that must take on a second-to-second basis to cause certain muscles to tighten, certain ones to relax, and to be able to keep your balance. So what we often find is that this upper cervical area, the neck area, if the spine is out of alignment or there's a restriction in the motion, that interferes with the signals not only going from the brain down to the body, but almost more importantly in this case, the body going back up to the brain. And so you're getting mixed signals from this inner ear, and this is where it can throw your balance off, okay? Now that's just the ear, but again, think about all the other things got to be adjusted. Just for example, your oxygen, your blood pressure, your heart rate, your digestion. I mean, these things are happening on a second-to-second basis. So if we take the example of balance, but if it's affecting balance, it's probably also affecting other areas, maybe digestion, again, maybe breathing. And a lot of times it's very small or very subtle in the beginning. You may not have any type of symptoms, but when it's left there for 6 months, a year, 5 years, your body starts to go into a dis-ease or a lack of ease, which eventually is diagnosed with disease. But remember, there's always a cause. And so oftentimes, even if somebody's diagnosed with an inner ear issue, I very commonly find that there's a neck issue involved as well. Maybe the neck issue even contributed or caused the inner ear issue. So we've always seen benefits. And I've had it just a couple times in my past, not a severe vertigo issue, but waking up and having just a little bit of almost like fogginess or being off kilter a little bit. That's probably the best way I describe it. And my wife adjusted me and just immediately I got relief. And now our goal again is not to treat the symptoms. We don't want you to have the balance issues because that's, I know it can be very distressing, but it's a matter of removing that interference so the brain can communicate with the body and the body can communicate with the brain. So our goal is always to optimize your health so you can go and live an abundant life. So if you know anybody's having balance issues, vertigo issues, even if they've been in the past, maybe they're not currently suffering with those, but they have bouts with those over the time, make sure they're getting their spine checked.